Please welcome the AANS CEO, Katie Orico.
Good afternoon. It's my pleasure to introduce this year's Charles L. Plante Lecturer. This lecture, named after neurosurgery's first professional advocate in Washington, D.C., and my mentor, Charlie Plante, features an individual who has made an impact on neurosurgical practice and patient care through health policy and advocacy. This year's AANS annual meeting theme, The Power of One, Impact of Many, reminds us of the ripple effect of a single individual's vision, passion, and leadership can change the course of countless lives. No one exemplified this more than Charlie Plante, a man whose integrity, humility, and tireless advocacy laid the foundation for 50 years of neurosurgical advocacy in Washington, D.C. Today, we honor another extraordinary individual who embodies that same spirit, Dr. Gail Rosseau. Well known to this audience, Dr. Rosseau received her medical degree from George Washington University, where she also completed her neurosurgery residency training. She spent most of her career in Chicago, Illinois, at the Chicago Institute of Neurosurgery and Neuroresearch Medical Group. About 10 years ago, Dr. Rosseau returned to the DC area, where she now serves as a clinical professor of neurosurgery at GW. In addition, building on her lifelong commitment to global neurosurgery, Dr. Rosseau also serves as an adjunct professor of global neurosurgery at the Barrow Neurologic Institute in Phoenix. Like most accomplished neurosurgeons, she has hundreds of peer-reviewed publications, presentations, and lectures. However, unlike most neurosurgeons, Dr. Rosseau has focused her work as a neurosurgeon not just in the clinic or in the OR, but also by harnessing the power of the media to help educate the public about neurosurgery and neurologic disease. Dr. Rousseau's impact spans continents. As a clinical professor, global health advocate, and international neurosurgical leader, she has transformed the delivery of care through collaboration, compassion, and advocacy. Whether promoting medical liability reform, leading global initiatives on traumatic brain injury and spina bifida prevention, mentoring young neurosurgeons in under-resourced settings, Dr. Rosseau has shown how the power of one surgeon can ignite change that reaches millions. Please join me in welcoming to the stage the 2025 Charles L. Plante Lecturer, Dr. Gail Rosseau.
Well, thank you, Katie, for that nice introduction. And many, many thanks to you, to Jacques Morcos and the AANS Executive Committee for the honor of being asked to give this 2025 Charles Plante Lecture. I am deeply grateful for the opportunity to give this presentation, which honors the memory of a generous man whose lifetime of advocacy was noble and who often said that doing what is best for patients will always be the best thing for neurosurgeons. Today, I'd like to talk about how our characteristic advocacy for our patients, as well as our deliberate culture of leadership, place us in a position to be the primary actors in a changing global healthcare landscape. Let's begin with the definition for global neurosurgery. As neurosurgeons, we've always prided ourselves on leveraging our internationalism for excellence, but this movement is beyond internationalism. It is a recognition of our expanding role in society. Global neurosurgery is the clinical and public health practice of neurosurgery with the primary purpose of ensuring access to safe, timely, and affordable care for all who need it. We can date this movement to the now familiar 2015 Lancet Commission report on global surgery. That report's important messages that 5 billion people lacked access, that 143 million urgent operations were being left undone each year, led to a unanimous resolution at the World Health Assembly to strengthen emergency and essential surgery. In response, neurosurgical scholarship in this field has increased dramatically, as anyone who is reading our peer-reviewed literature will attest. This scholarly work has brought the changes for our specialty into focus. More than 5 million essential neurosurgical operations are being left undone each year, largely because of a needed 23,000 more neurosurgeons. And all of our peer-reviewed literature has responded to this challenge, including the current issue of neurosurgical focus. In launching this issue, we, the editors, chose the global Olympic motto, the Latin for higher, faster, stronger, together. While our primary and indeed our ancient responsibility has always been to do the very best for the patient before us, the globalization of the recent past has brought us to the realization that we have an additional core professional responsibility. That is to support initiatives that bring the best possible care to every patient, everywhere. But we have seen that this is an enormous challenge, and enormous challenges need to be fueled by inspiration. Well, what better place than Boston to invoke the inspiration of President Kennedy? JFK launched his presidential campaign with a vision for the new frontier, calling for a new responsibility for citizens. From the belief that one person can make a difference and that everyone should try, came the famous phrase from his inaugural address, "Ask not what your country can do for you, ask what you can do for your country." 2 years later, his vision for a new frontier was embodied by the space program. So why is global neurosurgery our moonshot, our new frontier? Well, it requires inspiration to take on difficult challenges. To paraphrase President Kennedy in his moonshot speech, which laid out endless opportunities for peaceful cooperation in the world, why choose global neurosurgery as our goal? We do this because it is hard, because this goal will serve to organize and measure the best of our energy and skill, because that challenge is one that we are willing to accept, is one we are unwilling to postpone, and one we intend to win. So to take on this big challenge of access to quality neurosurgical care for everyone, we've used this most famous Bostonian's new frontier and the space program as a source of inspiration. So who is responsible for addressing the need for neurosurgical care? We can look at other groups who have taken on this role in the past: religious orders, philanthropic organizations, academic centers, the business sector to an increasing degree. But what is the role of neurosurgeons? Ducimus, we lead. This Latin term has been used by elite military groups, and it is bred into our culture. For our specialty, more than any other, is associated with a culture of leadership that includes discipline, training, perseverance, and passion. These qualities are hardwired into a neurosurgical career and are resources for our patients and for surgical patients everywhere. This brings us to the power of advocacy in global neurosurgery. I'd like to provide just a few examples of the tremendous work already going on in this movement, which by most accounts dates back just 10 years to that Lancet report and the WHO resolution. Well, the Global Alliance for Prevention of Spina Bifida F, which successfully translated 30 years of Class 1 as scientific evidence into action. The TBI Coalition, uniting supporters for better care worldwide for TBI. PRISM, the Partnership for Radiotherapy and Sub-Saharan Medicine. Expansion of the global neurosurgical workforce by many who are working, many of you here in this room, to train more neurosurgeons where they are most needed. advanced public health degrees with an increasing number of our residents and faculty acquiring this additional global health expertise, and global financing, including an event that took place today in Washington with neurosurgeons at a World Bank spring meeting. And finally, the development of and leadership of what we're calling the neurosurgical ecosystem that goes beyond just us neurosurgeons. And here are a few examples or illustrations of those examples. So this is advocacy toward the first ever neurosurgeon-driven WHA resolution, which strengthened folic acid fortification by Colombian neurosurgeon Kemal Gatmi. Or work toward expansion of the global neurosurgical workforce by America's residency programs with preliminary data from the Duke Barrow survey, to which many of you have contributed, identifying and characterizing the work being done in our academic training programs. Or advocacy for TBI reporting to make this a reportable disease so that we can get data that will help access to quality care. Now, many neurosurgical groups do their advocacy through the G4 Alliance. And full disclosure, I chair the board of directors. But this group has worked to gain surgeons a role in the large multilateral organizations that control public health, and has been effective at bringing neurosurgical voices to the table and then communicating that progress through publications, some of which are noted here. We know that the progress of these initiatives over the past 10 years is launching us into a new frontier and a bold new role for neurosurgery. And like the space program, we're moving in a direction that we would not have thought possible 2 to 3 decades ago. But we are learning about new opportunities for the financing of healthcare, for which there will always be a market. We are a relatively small group as a specialty, but the conditions that we treat are oversized in their impact on public health and federal budgets. Our sector is global and highly technical. So what is next for global neurosurgery advocacy? Like JFK's vision, our neurosurgical vision needs space to grow. Let me share with you an expanding vision for global neurosurgery, the Boston Declaration. In January, we published a paper describing a bold role for the future of global neurosurgery with a launch that would take place here at this gathering of the world's neurosurgeons here in Boston at this time. We called it the Boston Declaration. Combining public and personal networks, followed by chain referral, we sent invitations to hundreds of individuals and email addresses potentially associated with global neurosurgery. Since January, we have been having stakeholder town hall meetings. Many of you have participated. And we've described this landmark event, which aimed to build upon the foundation of prior work by expanding the global neurosurgical ecosystem and fostering tangible commitments. Our aim was for this event to be a celebration of collaborations to broaden global neurosurgical care and to serve as a resource for other specialties to chart a path forward towards global surgical care. The purpose of the Boston Declaration is to create a unified vision for the next phase of global neurosurgery, to support the expansion of initiatives and urge action through tangible commitments, charting a path forward for the second decade of this movement. To summarize, the Boston Declaration is a process and pledges. This is the first interlocking effort to provide a platform for everyone who cares about global neurosurgical care, not only individual neurosurgeons, but neurosurgical departments and associations, philanthropists and NGOs, industry and government, allied specialists and patient groups. The focus sharpened each month as the idea, the goals, and the logistics were given space and time to grow. Each month, we provided a summary of key takeaways, what we had learned from all the global colleagues from various disciplines who had participated in these calls in the previous month. We learned about challenges and specific needs, as well as resources to be shared, importantly, directly from those working in these areas. These conversations led to 3 areas of needed commitments: resources, engagement, and research and development. These were very important And we knew that they were important, but we also knew that we couldn't do everything, that we would need to use SMART goals that would allow us to be able to do specific things that were collaborative, specific, measurable, and time-honored. Because we have taken on a big challenge, because we know it will be hard, it was necessary to not try to solve every problem, but to encourage specified timelines for reaching attainable and time-bound goals. I'm delighted to report that at yesterday's event at the Edward M. Kennedy Institute, this brought together hundreds of people from multiple stakeholder groups who witnessed nearly 100 pledges that have become the Boston Declaration. It is a document that codifies where we are now in terms of commitment to global surgery and what we plan to achieve in the near term at 1, 3, and 5 years. Speaking specifically of advocacy, we are ambitiously planning the global neurosurgery presence at everything from the next World Health Assembly next month all the way to the World Economic Forum. As I close at what was once called the annual meeting of the Harvey Cushing Society, we celebrate the person who is named as neurosurgery's neurosurgeon of the first half of the 20th century. Harvey Cushing said, "The capacity of man himself is only revealed when, under stress and responsibility, he breaks through his educational shell. He may then be a splendid surprise to himself, no less than to his teachers." We also have the endorsement of this project by our distinguished service medalist, who is named the neurosurgeon of the second half of the 20th century, Professor Gassi Yazergil. He recently participated in an online celebration of his 100th birthday and was delighted by the disruptive innovation of the Boston Declaration. So he eagerly sent a video, which we showed yesterday and which I summarize here today. He cited the goals of this movement, the Boston Declaration, that resonated with him: connectivity across barriers and scholarship for all. In conclusion, my key messages, which I'm certain would resonate with Charles Plante as well, are that advocacy and leadership go hand in hand, that neurosurgeons are leaders, that neurosurgical care for all who need it is a big challenge, but that neurosurgeons will meet this challenge with principled advocacy and our unique culture of leadership. Ducimus. I would like to thank in particular the Boston Declaration Steering Committee, the G4 Alliance, the Global Neurosurgical Forum, Barrow Global, the George Washington University Clinical Care Alliance, and my many friends and collaborators here today and around the world. I thank you.